Hey everybody, Nick Espinoza, your chief security fanatic here. Don't forget to subscribe. But today, let's talk about the new private health tracking system that the United States is building. I've got a lot of thoughts on this. Not all of them are good. So with that, let's turn to the Associated Press's Amanda Seitz for some more information because, quite frankly, I think this is an important one. And here's a primer of what's going on. The Trump administration is pushing an initiative for millions of Americans to upload personal health data and medical records on new apps and systems run by private tech companies, essentially promising to make it easier to access health records and monitor your wellness. Now, President Trump is expected to deliver remarks on this initiative today, Wednesday afternoon, in the East Room. I am recording this prior to that press conference, but the event is expected to involve 60 leaders, roughly 60 leaders from tech companies, including Google, Amazon, as well as hospital systems like the Cleveland Clinic, which is one of the bigger ones here in the United States. This new system is going to focus on diabetes and weight management and also have conversational artificial intelligence that is supposed to help patients, as well as digital tools such as QR codes and apps that registers patients for check-ins and track your medications. The initiative is spearheaded by basically an administration that has already freely shared highly personal data about Americans, you and I, in ways that have actually tested legal boundaries and could put patients' desires for more convenience at their doctor's office, essentially on a collision course with their expectations for keeping their information private. And that is actually one of the big things that we are talking about. Past administrations have not had like a DOGE where they are going in, installing software with basically no transparency, and then collecting a whole bunch of data, whether it's health information on us, taxpayer information on us, et cetera, et cetera. And so that's a very serious breach of trust right out of the gate. And then basically to voluntarily want to give more information to that system when the trust has been breached, that's a tough sell for a lot of people, especially if they're paying attention to these kinds of things. Now, a lot of people are not, et cetera, et cetera. I also know in this political climate, it really comes down to who you trust. There'd be people out there that if the Biden administration did this, they'd say, oh yeah, it's fine because it's Biden, in the same way that the Trump administration is doing it, and people would say, oh yeah, it's fine, it's Trump, I trust Trump, et cetera, et cetera. My point being is, this is agnostic to the politics of the situation. Governments that are centralizing information and data on us, I think, quite frankly, should be of deep concern, no matter who is running the government. And I think that's a big issue. Now, Lawrence Gostin, a Georgetown University law professor who specializes in public health, said, and I quote, "There are enormous ethical and legal concerns. Patients across America should be very worried that their medical records are going to be used in ways that harm them and their families," end quote. Officials at the Centers for Medicare and Medicaid, who basically will be in charge of maintaining this system, have said that patients will need to opt in for the sharing of their medical records, which will be kept secure. In other words, we're assuming that you can maintain your opt-out status and they're simply not going to ingest this, but they've already done a lot of that before earlier this year. That's the concern, right? So those officials say that patients will benefit from a system that lets them quickly call up their own records without, any of the standard difficulties, such as requiring fax machines to share documents, which is something medical community has seriously been behind on, and basically, other obstacles that have prevented them from getting their information very quickly in the past. Popular weight loss and fitness subscription service Noom, for example, has signed on to this initiative, would then be able to pull medical records after the system's expected launch early next year. So that might include labs or medical tests that the Noom app could basically use to develop an AI-driven analysis of what might help you lose weight. That's according to their CEO, Jeff Cook, talking to the Associated Press. And apps and health systems will also have access to competitors' information as well. So Noom would be able, for example, to access a person's data from Apple Health by virtue of that. Now, you might trust Apple, but not Noom, or Noom, but not Apple. And now, essentially, we're mixing and matching and giving a lot of these rights to a lot of these different apps and platforms, which means we have to trust that we're not going to get data breached, that they're going to maintain our privacy, even though we know we're being data mined constantly. This is an incredibly uphill battle for privacy rights, and digital privacy advocates are skeptical that patients will be able to count on having their data stored securely. Like I just said, the federal government basically has done little to regulate these apps and telehealth programs in the past. There's huge loopholes even in GINA, which is supposed to protect our genetic data that I've talked about Not to mention these apps like, period tracking apps, menstruation tracking apps that basically had no HIPAA protections whatsoever that could be used by state, local, or federal government, basically to track, per the abortion debate, all these kinds of things. This is a huge thing. I mean, essentially, this is an open door for the further use and monetization of sensitive data and personal health information that we are continuously collecting as we are giving this to the doctor. Now, the problem that I have here is a couple-fold. One, they might be able to take this and start making causal relations between different family members who may have, let's say a different genetic makeup than you, but similar issues, and then potentially, raise your premiums on insurance on top of it. If they're going to sell this to data brokers or have data mining that's going to be another big issue. Not to mention data breaches. Imagine if, Russian hackers get into this thing and decide to ransom the entire database out. And we've seen massive data breaches from major tech to small tech, and it's a big, big problem. So I'm not a fan of this whatsoever. The privacy implications, I think, go way beyond, just simply storing and aggregating your data. But when a government wants more information on you and is offering you services as a result of that information, you should be skeptical out of the gate. I don't care what the government is. It's just kind of privacy 101. And please like, share, follow me here on Facebook and Twitter, Nick AESP. And please feel free to subscribe to me at YouTube as well. And as always, stay safe, stay online, and please, I'm going to say private, informed, and secure. Take care.